Hong Kong says it has detained one airline passenger infected with a new UK variant of SARS-CoV-2 who flew in from the Philippines in late December 2020. But the Department of Health says that a preliminary check of 300 COVID-positive patients has not shown any sign of the new variant. Is the new UK variant really here? And what can we do about it? And how far are we in procuring a vaccine against COVID-19? We discuss in this episode of The Chiefs. And welcome to this midweek edition of The Chiefs. With us, of course, is Ana Marie Pamituan, the editor of the Philippine Star from the port area in Manila. Hi, Ami. And joining us in a while will be Robel Ampay of One News. Luchito Valdez will not be joining us tonight. Ami, anong big story niyo? I suppose yung pag-release ng yung tatlong inaresto ng pulis
tama
for Christine Dacera sa
Tama si Brigadier General Danao, di ba? Sinabi niya sa ating kagabi, the case is still unresolved. Kaya pinakawalan nga ng mga prosecutor.
Yeah, and remember, ang sabi ni General Danao sa ating kagabi, it will probably be remanded for further investigation
to the
prosecutors.
Oo. And he was warning na baka mapahilan daw ng administrative case yung mga pulis, di ba? Yung mga investigador if they bungle that case. Pati si Sal Panelo, si Presidential Legal Counsel, sabi niya, maghintay muna matapos yung kaso, bago mag-file ng mga kaso para malakas yung, well, if there is even a need to file a case, di ba?
Which makes sense eh. Kailangan mo nang tapusin yung kaso bago mo i-file.
Oo. Tama, wala pa yung mga toxicology, wala daw semen eh. Yun ang initial report ha. Wala naman daw nakita. So paano, although rape can happen without,
Yes, that's true. But it does call into question the earlier pronouncements made by Colonel Depositar ng Makati Police District, Makati Police Office, when he said na they found semen sa genitalia pero wala naman dun sa medical legal report. And one would wonder kung bakit alam niyang may semen sa genitalia kung hindi naman siya nag-examine. Wala naman sa report.
Siguro baka may report about the CCTV footage. O baka may makitang doon. Although yung nakita ko sa TV kanina hindi naman yata masyadong incriminate. Although yung isa dinadala siya, di ba? Dinadala siya doon na mukhang lifeless na.
Baka that was when they discovered her in the bathroom and they brought her to the room
so,
for resuscitation.
Well,
but the actual death, well, not the actual death, but the events preceding the death would still be a question mark. Kasi you would suppose naman that nobody should put CCTV in the bathroom to begin with. So
meron bang nakuha TV5 na portions of that footage? Meron ba?
I'm not sure. I saw a report about the footage, but I'm not so sure if we have the footage itself. Yesterday kasi nakita ko in some newscasts were still photos or grabs of the CCTV footage, not the footage itself.
Yun lang kasi di ba? Yun lang parang aisle yun aisle dun sa hotel. Yun lang naman nakunan So hindi malaman talaga kung ano nangyari.
Yeah, so, because you cannot have CCTVs inside the rooms themselves because that would violate your privacy.
Although ang rason nga ng Makati Police, pag hindi daw sila nag-file, baka hindi nila ganun din na nangyari. Hindi rin nila na-detain ng matagal yung person of interest. Yun ang gusto nila ma-question. So, yung 11 hinahanap, the rest of the 11, ewan ko kung haharap pa sila, they might have to be formally invited. Ayan na si Robbie.
Hey, Robbie. There's Robbie.
Hi, good evening.
And tapos kagabi pa, humabol kagabi yung announcement ni PNP Chief de Bolsinas ng manhunt.
Manhunt na.
With the threat directed that those who would protect or hide those he was hunting, that they would be arrested.
Kasi may formal charge nga. May formal charge that's a serious crime Di wanted ka na nga kapag gano'n. Kaya nga nagtatagmo nga umiyak nga yung nakiclear de la Fuente. Wanted na daw siya.
Yeah, kaya ang problema ngayon is we understand what the police, or at least some of the leadership of the police are doing, we still don't understand what exactly happened, di ba? Kasi I think you already mentioned, yung tatlong nakadetain kahapon, pinarelease na muna ngayon. And as General Danao was speculating and anticipating yesterday, it will be just most likely referred for further investigation, which is what's happening now. So all of these determined statements from the police are being backdropped by a lot of questions to the police as to whether or not they even have enough to go by.
Well, yung decision ng prosecutor is essentially a rejection of the complaint filed by the police immediately after the arrests. It basically is that. In other words, mag-imbestiga pa kayo at come up with more evidence before you file the case.
Siguro, Philippine Airlines yan ang pag-uusapan natin ngayon yung isang malaki pang istorya ngayon is another case involving Philippine Airlines. So, siguro natin yung
Ami, you never cease to amaze me with your ability to connect the dots and make a segue. You were able to do it. I was wondering how you would do it. But anyway, here we go. Okay. As we said a while ago in our introduction, our topic tonight would have to do with the new UK variant and reports coming in that the variant, somebody with the variant came from the Philippines. So we're bringing in tonight for our first guest, one of our consistent guests, see Father Nick Austriaco, who is also a molecular biologist as well as a fellow of OCTA Research. Father Nick, good evening and welcome back to the Chiefs.
Good evening and happy New Year.
Happy New Year, Father.
Happy taking some.
So, B117 tonight, huh? The UK variant, B117.
Yes, Father.
Okay.
Father, yung B117, Father, well, of course, you have heard about the reports coming from Hong Kong that one of the passengers coming from the Philippines on December 22 tested positive for the B117 variant. However, ang sabi naman kanila ng DOH, they tested 305 samples using the Genome Center, of course, for gene sequencing, and they found no evidence to show that the UK variant is here. Well, help us to make sense out of this. Which one do we believe and which one carries more weight? Yung 305 samples po ba, is that representative sample?
So you have to put everything into perspective first of all. So the B117 variant appeared in the United Kingdom in September, and it has been spreading gradually. So and it arrived in Singapore on the 6th of December. So this was 2 weeks before we closed our airport and our borders to UK. So it's not. One of the things you can imagine is that it entered the Philippines around the same time it entered Singapore at the beginning of December when people from London were returning to Asia for Christmas. So you can imagine that. It's not, it would be plausible. Now, this is only 1 or 2 people. So because the numbers are such that it's a very low number of people who came in. So now it enters the Philippines and you're going to sample and you're going to try to find it. Well, if you have 100 people and only one of them has it at the beginning of December, you can imagine that the sampling will miss this one person. But this person happens to talk to the person who went to Hong Kong on December 22nd. So then it's still to her, I believe it's a woman, according to the news report, she's a 30-year-old woman. So the way you bring this together is you say it is likely now that the variant is in the Philippines, but it is also likely that it's still very rare, right? So you can say 2 things. It's in the Philippines because that you need to say that to explain how this woman got it while she was here. Now, we don't know about her. You know, was she here for 2 days? Was she here for a month? We need to know some of that information in order to judge her exposure. If she was here for 2 days, then it's possible she got it from someone else from where she came from. So we need more information. But at the moment, I think I would say one, it's probably here, but it's still probably very rare. And that's why sampling from the Philippine Genome Center has not yet picked up. You would have to be very lucky. If it's very rare, you would have to be very lucky to have picked up one of those samples in the number of people you were testing.
Hey, Father,
Father,
outside of testing, given that one thing I think understand about B117 is they say it's 70% more mas nakakahawa siya, no? It's easier to spread. At a certain point, even while the testing capacity could be limited, will it start showing up in the numbers?
So yes, so what will happen is that if it is able to establish itself, it will continue to spread and it will overtake the current variant that we already have. This is what is happening in Denmark, for example. So in Denmark, in the course of 2 weeks, it went from 0.1% to 3%. And they're expecting by the end of this month for it will be 50%. So you see, it's an exponentially growing strain. So so if it's here already, it's a very low numbers. If we are not careful, it will establish itself and it will begin to feed an exponential rise. And if so, we will see that in the next few weeks.
Father, you say
And if you see that exponential, if you see that numbers rising and trending faster than we've seen it in the past weeks, that increases the plausibility, as you said, of confirming that it's already here.
So researchers have proposed that it will increase the R by about 0.5 to 0.7. So if it was if it's 1 now without the variant, with the variant it'd be 1.5. And so what you're going to see is you will see a rapid escalation in the R. But that will take a while because it's very rare right now. Like I said, in Denmark, it took several weeks. So it would take several weeks for it to take hold.
But Father,
is it like a 50% increase, Father? Would that be a correct way of looking at it? A 50% increase from 1 to 1.5 R?
You would say it is so much more. So let me give you another number. So for the typical coronavirus variant, only 10% of close contacts become positive. For this one, it goes up to 15%. So it's called the secondary attack rate. So if you have the close contacts, you measure how many of the close contacts get COVID. Typically, it's 10%. With this variant, it's 15%. So it's it's about 50% more transmissible in the long run.
Father, I'm looking at what's happening in other countries, and it's spreading really, really quickly. And you're talking about being more careful. You think the protocols we are following now are enough to contain this, just in case it's here already? Or would you be suggesting that we tighten restrictions, at least in Metro Manila?
Well, I mean, if the variant has arrived and the Hong Kong scenario suggests it is here, we have to be extra careful about mobility, right? So you want to decrease mobility. So in the UK, they tried to do that. If you remember, in November, they tried to do a partial lockdown, but the variant was so transmissible that even during the partial lockdown, it was spreading through the children because they did not lock down their schools. So they locked everything down, but their schools were open, so it was spreading amongst the children. And so you saw a rapid rise in cases even in a lockdown, which is why they had to increase the lockdown. So yesterday they are now in a full lockdown, no more schools. Now you will notice we actually never really opened up in the way that the UK opened up. So we still don't have schools. So already our baseline quarantine and what we call a lockdown is significantly more strict than what Western societies often deal with. But the government has to be ready. If we see that spike, we are going to have to roll back mobility really quickly in order to prevent a MECQ. Because as you see all over Europe, once the numbers become uncontrollable, they did not only have to go to MECQ, they basically are now back into ECQ because the numbers were so dramatic. Yesterday, 60,000 cases per day in England, right? And I mean, we have never gone over 4,000 a day. 4,000, we entered into MECQ in August. We cannot imagine 6,000 a day. I mean, our hospitals will be destroyed by that number.
What
Hey,
might
Father,
be
I'm just curious. We
for tightening restrictions? What might you suggest? Priority areas for tightening restrictions, just in case.
So I mean, we were already talking about this before the B117. OCTA was already suggesting, we opened up the economy for Christmas. We understood that, but we also talked about, and the European societies are doing that, extending the curfew at night, preventing groups from gathering inside. So closing down, they closed down gyms, they closed down libraries, they closed down theaters. So again, the initial focus should be scenarios where super spreaders can happen, right? So any closed, crowded, indoor places, let's prevent that from happening.
Hey, Father, we say, when people have gotten used to hearing this, it's more transmissible, it's more transmissible. Do we understand what it is about our behavior or what it is about this virus that makes it more transmissible? I mean,
Okay.
we people have gotten used to certain standards in their minds. Now, it's 15 minutes or more close with someone, that's considered a close contact. What is it? Is it about staying longer? I mean, what is it that makes it more transmissible?
There are two things we think that could happen. One of them is people who have this virus make more virus. So one possibility is if I have a B117 and my cousin has the regular variant, I make twice as many more viruses. So I am sending out twice as many viruses. So that's one possibility, and there's actually evidence from the UK that this is happening. But the second is we think that the virus is more efficient at entering the patient's body. So the older variant, let's say you need 1,000 viruses to get sick, now you only need 500. So what happens is not only are people making more virus, you need less virus to get sick because the virus is able to open your cells more efficiently than the old variant. So it's and people, thank God it's not more deadly, so it doesn't kill worse. But you see, that doesn't mean that the death numbers will not rise, because if more people get sick, then there simply will be more deaths because the same percentage of sick people are going to succumb, right? And that's what they're seeing in the UK now. So they're having more deaths, not because it's more lethal, but because the numbers are so great.
But you still inhale it. I mean, it still enters your body through your. I mean, it's still that. So it's still. But does that change our mindset in terms of what kinds of masks we should be wearing, or are we still are the best practices still basically the best practices?
The best practices are always going to be the best practices, right? Now, people will say, does it affect the vaccine? I know you're going to be speaking about the vaccine. We do not think it will escape the vaccine. So just to give you a point of comparison, so measles has the vaccine for measles is about 50 years old. And there are so many variants of measles, but we have never, the measles vaccine variants have never escaped their vaccine in 50 years. Now, in the other side, you have flu, and it takes flu about 5 years to escape its vaccine. And it is much more changeable than coronavirus. So coronavirus is going to be somewhere in the middle. It's either, we're not sure yet, we're still waiting on that. But we do think it will decrease the efficacy of the vaccine. So you know that right now, Pfizer is 95% efficacious. Moderna, I think, is 94, according to the papers that were published in the last few days. what you might expect is with the new variant, it will drop to say 85. It will still be able to protect, but the efficacy will drop.
Why do you say that, Father? What's the basis for seeing that drop and calculating that drop?
What you see the Moderna vaccine is against the key that the virus uses to enter your cells. It's called the spike protein.
The spike protein.
And the B117 has actually changed that spike protein in 8 different ways. Now, it takes many different changes to escape the vaccine, but even just a few changes can decrease the effectiveness of the vaccine. There are experiments that are being done to determine this, but a lot of scientists are expecting this to happen. Now, believe it or not, the Chinese vaccines, because they're not against spike, they're against the whole virus, are less susceptible to this kind of change because because you're not targeting a specific spike. The whole virus is there, and so the immune system is against the whole virus rather than the spike protein.
This is a traditional vaccine.
That's why the traditional vaccine. Yeah, so you will see that the traditional Chinese vaccines are being touted as resistant to variants. And the reason why is because you're not giving the patient a very small part of the virus, you're giving it a large part. So even if the small part changes, there are so many other parts that the body can still attack.
Father, they're resistant to variants, but in the Philippines, I think our problem is resistance to the vaccines itself. OCTA conducted a survey, that's an informal survey, right, on acceptance of vaccines in the Philippines.
Yeah, so
about it.
So OCTA conducted a survey just before Christmas. We hired someone to interview 600 residents of the NCR, and what you're seeing is that you're seeing very vaccine hesitancy across the NCR of varying degrees. Now, I also spoke to my students at UST at the end of the finals period, and you can also see this vaccine hesitancy. And I think, the vaccine hesitancy it's a new drug. It's not quite clear. People are worried it was made too quickly. One of the advantages, I think I pointed this out last time we spoke, one of the advantages that we are going to get because we are not getting vaccines right away is we are going to benefit from the experience of hundreds of millions of vaccinations all over the first world. So we're going to see that. Now, with regards to vaccines, again, my students, it's an informal conversation. What I notice is many of my students are hesitant about the Chinese products. And they're hesitant of the Chinese products because over the last 10 years, there have been stories of substandard medical products out of China. They were telling me about contaminated milk in 2009. And so I think there is even my mother is hesitant about the Chinese vaccines only because she's just very hesitant about the quality of the manufacturing process.
But
so we will see.
What about the OCTA survey? What about the OCTA survey? Did you ask them about brand preference? Are they against vaccines per se, or are they against Chinese-made vaccines?
No, in our survey, we just basically look primarily at vaccines for now. We did not really specify individual countries. So I think it's interesting, rather than brands, because most of the ordinary people are not aware of the brands. If you speak to them about the country of origin, that's really where. And you can see even in Navotas, there was an informal survey. And again, you have residents of Navotas who are very hesitant about Chinese vaccines. So I would not be surprised. The OCTA survey did not directly address that question, but I think from informal conversations I've had and with things that I've read in the news, Filipinos overall are deeply wary of vaccines from China, and we will have a lot of work to do for that.
Okay. But is it also awareness about vaccination in general or just in this specific moment in time about COVID?
Well, I mean, you have after the long-term consequences of the dengue vaccine crisis in 2017. So a lot of people remember that, right? So they remember children getting sick. And so parents are deeply concerned that you're going to get a repeat of that. Now, it's interesting because none of the vaccines so far have actually been approved for children. So any vaccine that we will receive in the next few months is going to be slotted for adults, right? So, but families don't see that, and so parents are worried it's going to affect their children. And I think what government has to do, especially the LGUs, and I know Quezon City, because I'm working with Quezon City, is going to do is we are going to roll out a information campaign to help the residents of Quezon City and therefore throughout the NCR and hopefully throughout the country to better understand these vaccines. I'm working with my students at UST. We're developing infographics in English and Filipino on the different vaccines just to help our kababayans to understand what is going on. Because you are always scared of what you don't know. And so we're trying to help them to understand how many hundreds of thousands of volunteers were tested. If you combine all of the volunteers in all of the trials, hundreds of thousands of people have already been vaccinated. And so we have a good sense of how this vaccine is working.
Okay, Father Nick Austriaco of Octa Research, also noted microbiologist. Father Nick, thank you again for joining us tonight.
Thank you. God bless you.
Thank
Bye.
you. Thank you, Father.
We will just go into a break, so please stay with us.
Welcome back to the Chiefs, who are now in the final stage of our conversation. And I would like to welcome the Director General of the Food and Drug Administration, Undersecretary Eric Domingo. Good evening, Yusek Domingo.
Hi, good evening, Amy. Good evening, everybody.
Yes.
Good evening po.
Good evening, sir.
Yusek, natatakot na mga tao. Nandito na daw yung UK variant. And there's even more pressure now, and people are more anxious to get the vaccine. What's the latest? Nag-apply na, we understand, nag-apply ng AstraZeneca for emergency use authorization. What's the latest?
Well, we had, as you know, we had an application from Pfizer, no, right before Christmas, and we're now at the later stages of
Mhm.
the evaluation of this application. I feel that we'll be ready with that by next week and finish with that. And of course, yun nga yung news for today. During the afternoon, before I left the office, AstraZeneca also sent in their application for emergency use authority. So that yan na yung susunod na bubunuin namin, no? And we will be sending that to our evaluators tomorrow morning.
Yusek, best case scenario, gaano kabilis kung aaprubahan nyo? And how soon can we see a vaccine here?
Well, the government is really targeting the first quarter of the year, no? Mga March makaumpisa na. Pero yung talagang sigurong medyo marami, no, yung by bulk for the companies to be able to manufacture and then supply to us, I could see siguro the bigger proportion of supplies coming in towards the second quarter of the year.
Yusek, we've been asking this of some people already, but I wanted to ask you, yung po bang mga emergency use authorization sa iba-ibang bansa, whether it's sa US, sa UK, sa Russia, sa China, do we all take that equally, or are some EUAs carry more weight than others?
Yes, no, they do. Some do carry wormwood. For example, yung WHO na emergency use listing, ito ang tawag natin dito, we can recognize it, no? It's a recognition pathway. Pwede tayong mag-confirm lang sa kanila, and then we can actually recognize regulatory decision. And then the second level is what we call the stringent regulatory authorities, like US, UK, Europe, sa Canada, ganyan, Singapore. These are what we call the stringent regulatory authorities, and we can practice what we call reliance on their evaluation. Meaning, pag nabasa natin yung kanilang evaluation, malaki yung weight niyan, no? Matimbang siya sa pagdedesisyon natin. Of course, the other regulatory agencies that are not known to be stringent regulatory agencies are a good first phase, no? Kailangan kasi ma-approve pa rin naman siya ng kanyang sariling bansa, no? At eligible na siya mag-apply sa atin. Kaya lang, if it comes, for example, from a country like China or Russia na hindi recognized worldwide as a stringent regulatory authority, then we just have to do a more thorough evaluation by our experts and by our regulatory personnel here in the Philippines.
Well, Doc, it's good you mentioned Russia. I remember late last year there was an offer by Russia to have the vaccine of Sputnik manufactured here in the Philippines para wala nang problema ng importation and all that. I was wondering how far that went, if it moved at all.
Well, they were talking to the OST with that, no? Start maybe with something small like what they call fill and finish, no? Yung dadalhin tapos nilalagay na lang natin sa bote muna. But I think kasi kaya lang kasi yung manufacturing and then the technology transfer, that would make maybe 2 or 3 years, no? And we have to prepare for that. So for the actual needs right now, hindi pa talaga yun yung magiging solusyon natin. We will have to import the vaccines at this time.
Okay, now, Yusek, given everything that you've mentioned, all the considerations, all the complications, and we know it's a complex situation, let's try to give the people some expectations as well as manage their expectations. Ano na yung timeline? When are we expecting? We understand that this is also a supply matter, and it's also a matter of us getting in line. So what's the most realistic, what's the most optimistic, and what's the most pragmatic way of anticipating kailan po ba magkakaroon ng vaccines for the general public?
Well, for the beginning of the vaccination, no, hindi siguro general public, but the talagang primary natin, yung mga first priority natin, health workers, maybe some senior citizens, talagang hinahabol nila yung March nila Secretary Galvez, yung March of this year, no, itong first quarter of the year. Pero like I said, ako realistically, I think yung medyo mas maramihan na pagbabakuna na makikita natin sa community, sigurong talagang second quarter. Kasi nakapila tayo sa order, no? And like, for example, Pfizer might not be able to fill in our orders immediately. Baka yung AstraZeneca, mas mabilis pa siguro kesa sa Pfizer. Pero talagang siguro po, ako I would think, pinakamaaga na talaga yung March. And then second quarter of the next year would be a more rapid pace.
Yusek, anong status ng mga vaccines made in China? Sinopharm and Sinovac.
So both of them have emergency use authorization in China. Sinovac actually got conditional approval from Sinopharm. Sinopharm got a conditional approval from China last week, which is like a more widely usable na EUA din. Dito sa atin ang nagtatanong na yung Sinovac. Sinovac has been making inquiries with FDA asking us about the requirements and the process for an EUA application. So tingin ko malaman. Sa Sinopharm medyo wala pa talaga kaming no feelers at this time.
Walang natatanggap.
Yes,
You
sir.
are
Pero sir, yung
looking-
Sinopharm yung nakapasok kasi yung Sinopharm yung ginamit.
Oo nga.
Which brings us to that issue as well. The other night po, the president himself warned off the Senate against investigating the PSG. And we, of course, understand that the FDA is doing its own investigation. We heard you a while ago, sabi nga ninyo, mukhang itutuloy naman ng FDA. But we'd like to ask po kung una-una, do we have any updates on the investigation into the vaccinations using unauthorized vaccines?
Well, wala pa naman kasi I think my enforcement unit, I told them to look at this all at the same time kasi aside from dito ngang nababalita na meron daw sa PSG, nababalita din dong si Angsi na may 100,000 daw na pogo. At the same time, may mga inattempt kami na hulihin dati sa Binondo, wala kaming nahuli. Tapos sa Makati, that clinic in Makati, that building that has supposed to have a lot din, wala pa kaming nahuli. No? But the rumors are so persistent that there must be some there must be some
Yes,
truth
Doc.
to it.
We
So
understand,
so I really
pero Doc, yung sa
directed
PSG
our
po is not
enforcement unit.
But talking
in
PSG
the
po is
case
not
of
a
the
rumor
PSG.
anymore. Kasi the president himself said it and General Durante himself admitted that they did it. So iba na po
Well,
yung
except the
ibang
last
level na po
time-
siya sa
The last time nung meeting nung Monday, parang hindi ko rin malaman kung nagkaroon talaga ng bakunahan o wala or who did it on what did it. I really have very very vague information on it. But yung enforcement unit namin is investigating everything, all of it. Kasi ang hinakabol naman natin dito yung safety, no? Yung nabakunahan na tao, hindi ko naman huhulihin yan. Yung pogo worker na nabakunahan, hindi naman yan. O kung may sundalo man na nabakunahan. Ang concern ko kasi, merong possible na may vaccines na nakakapasok na hindi natin alam kung paano nakaka-handle yan. The person who's bringing them in probably does not have a license to operate as an importer of drugs, probably does not know how to handle drugs, and does not know that these are high-risk medications that you inject into your body. No? So yung talagang safety issue, I think, is something that has to be resolved, and we really are working with the NBI and the Bureau of Customs on this.
May deadline po ba tayo dito? Do you have a target for when you would expect to wrap up the investigations and share your findings with the public?
Well, yung aking field regulatory office, no, ang sabi nila, kaya nila in 20 days, no, to do this investigation and give me a report.
20 days from when po? Because mga 2 linggo na itong that's 20 days from when?
20 days from Monday. 20 days from from this week, yeah.
You said
Well,
Because I'm
Doc,
just,
not to put you-
I'm just curious. With the president saying he doesn't want the PSG cooperating with any investigation, you still have options to move forward on this. I mean, and what is the way forward now for your investigations if the PSG is not cooperating?
Well, there are many leads naman kasi, no. I think ito ngang mga sila si Angsi, yung mga informers natin sa Binondo na nagsabi sa atin dati na meron. Maybe we can find a way to piece the puzzle together, and if we're working with NBI and the Bureau of Customs on this, hopefully we get some information that will be useful in enforcing the mandate of the FDA to make sure that only registered, safe and effective drugs gain access to the population.
Doc, sorry, diretsuhin ko po kayo, Doc. Is the PSG cooperating with you? Is the AFP cooperating with you in your investigation?
Hindi ko pa naalaman eh. We did send some letters, asking for for information, but kasi parang araw ba na ngayon? Nung Monday yun eh. Wala pa naman akong alam kung may resulta, kung may sagot na.
yung enforcement arm nyo ba, you have enough resources and manpower Kasi parang ang dami nakakapasok na mga ganyan, hindi lang dito sa vaccine eh. Kumusta
We
yung
only
mga
have 100. You know, we only have 100 enforcers. Tapos yung 100 na yan, nagbabantay pa yan ng lahat ng butika, ng mga
Yes, yun ang
factory na nag-i-inspect, no? So, we really need the help of of the local government unit, the PNP, NBI. Yan usually mga nakikipagtulungan kami. Kaya nahihirapan ako pag may magchichismis na, yan kamukha no, hingi tatanong ko nga kay Ma'am Tessie Angsi, meron nagbabakuna 100,000, sana po maituro sa amin kung saan. No? Kasi hindi kayang suyurin ng mga tao ko ang buong Metro Manila. Sometimes people would send me a text na, I know that I heard that somebody went into this or chismis na these 3 congressmen daw went to a hotel. Can you please tell me which hotel it is? The public also has to help us because we cannot do it on our own. Primary concern pa rin namin syempre yung gamot na nandyan sa mga butika. But with things like this, we really need the help of everybody.
Baka
Pero
kailangan
not to
ng
put you on the
reporting
spot po, pero
hotline.
may captive audience na po kayo sa Malacanang Park kasi nasa barracks lang po sila. Tumami na po sila. So you don't need to look anymore for other sources of information. They're right there at Malacanang Park. Sorry for putting on the spot, pero yun nga po kasi the President himself made the declaration and General Durante himself made the declaration.
We did ask,
that makes
like
it more
I said,
complicated nga lang for you.
Yes, of course. Like I said, we're asking for information, but they also have their orders, no. So, we have to if we as we are continuing with this, we just might have to look at other ways to get information.
Kanino naka-address yung letter, USEC? Sa
Kung
PSG?
di po ako nagkakamali sa PSG po, doon sa head ng PSG.
Kay General Durante.
Opo.
But have you gotten in
you-
touch with Tessie Angsi naman? Have you gotten already?
Yeah, we did. No, I did. No, and especially through friends from the Filipino-Chinese community. No, pero yun nga, wala pa rin akong makuha rin na details. No, and I really would appreciate it if they can give us just a little more detail so that we can focus our work better. Kasi hindi naman kasi kami hindi naman kami sa talaga police at saka hindi naman kami mga
Yes,
naman
we understand.
hindi kami mga detective gamot kasi talaga yung alam namin.
Yusek, we really feel for you. We really, empathize.
We understand your dilemma.
And we will repeat that message for you. Your number one priority here is health and safety. But we're just para lang po to give us an idea also on how complicated this should be. Not just the investigation, but even the whole matter of getting contraband vaccines. I'm trying to get a picture of this. When you talk about when the PSG says, hindi, wag niyo na problema yan kasi sinong nagturok. Kami nagturok sa amin. And then at the same time, on the other hand, when Tessie Angsi says, maybe 100,000 people, I want to get an idea, sir, based on what you understand of what was used or what was going around. How hard is it, for example, for the PSG? How plausible is it for them to bring it to Malacanang with nobody else knowing? How hard is it na turukan mo ang sarili mo? And 100,000 doses, how hard is it or how easy is it for that matter to actually bring that into the country? What does this look like when this enters the country? What does it look like when it's finally administered to an individual?
A few doses is not difficult to imagine. Lahat naman tayo nag-uwi na siguro ng ilang bote ng vitamins, no, or ilang di ba, or ilang bars of chocolate. Parang ganun lang naman yun eh. And in fact, the FDA does not bother with that, no. For personal use, papayagan naman namin kayo mag-uwi ng gamot ninyo kung galing ka sa Amerika halimbawa, Pero yung 100,000 doses, medyo malaki na yun, Hindi na siguro yun, hindi na lang man isang balikbayan box size yun or dalawa, This is, and they have to be kept in a refrigerated condition kasi with temperature control tayo dito eh. You have to keep it in 2 to 8 degrees which will not be maintained if you put them in the box. So na-imagine nyo kung pinasok ito sa balikbayan box tapos dinala dito, by the time dito panis na siguro yan, it probably doesn't even work anymore or it might have turned into something toxic already. Kung naman dinagay ito talaga properly sa isang refrigerated van, mahirap naman siguro ma-escape sa mata yun, dahil kung talagang yung ang gamot kasi basta dinala mo rito, ang unang hihingin ay yung FDA clearance, no? Your FDA registration. So if it was kept in that in where vaccine should be kept, madaling makita 'yon, no? Mahuhuli 'yon. So baka tinago nila sa mga balikbayan box. And you imagine how that was handled and how that is how that can be so dangerous to the people who will receive it.
Yusek, may
No, so
isa pang
I think you know what where this is. Go ahead, Ami. Sorry.
May isa pang product na pinag-uusapan ngayon kasi si Presidente rin na nagsalita the other night. Sabi niya gusto na daw niya yung saliva test dito. Kumusta naman yung process? Kasi Department of Health said 4 months na raw with the Philippine Red Cross pala nagsabi that it's been with the DOH for 4 months na. Kumusta naman po yun? Yung
Okay, yeah, let me explain this one, no? Yung kasing saliva test, ang kit kasi na ginagamit nila is a kit that they're using for the nasopharyngeal swab. Yung kinukuha sa ilong, no? Tsaka sa bibig. Kaya lang, imbes na kumuha ng swab, same kit, gagamitin nila, laway na lang. Saliva na lang yung gagawin. Tapos pinapa-approve nila ngayon sa DOH na gamitin na lang yung laway imbes of the swab. So ang sabi ng DOH, kaya problem, yung kit mo, registered yan sa FDA as a nasopharyngeal swab kit. Dinesign yan for a nasopharyngeal swab. And then they made a study saying na 90% din naman, more than 90% din naman ang accuracy niya kung laway ang gagamitin. So ang sabi sa kanya ng DOH, kung gusto mo siyang gamitin for saliva, kailangan pa-approve mo siya sa FDA as a saliva test kit. No, not as a nasopharyngeal test kit, tas gagamitin mo sa
So it's the same kit. What you will need to approve is an innovation on the process.
Yes, an innovation on the specimen that will be used for it. And they say naman that they have the data from their study. However, hindi pa nila, wala pang nag-a-apply kasi syempre yung pwedeng mag-apply nun, yung may-ari ng technology, no? Kung sino yung gumawa ng kit. If the owner of the kit, the maker of the kit wants it to have to be approved as an additional test kit also with using saliva specimen, then they should apply for it. So we have advised naman the Red Cross that if you want to apply for this to be used as a saliva test kit, fill up an application and then submit to us all the data so we can evaluate it. Pero wala pa rin pong application naman at this time.
So gaano katagal yun kung ganon? If you're going to a company, sige kung mag-file yung company ng application for approval, how long will that take?
Oh, with the FDA, a few days. I think it's a very straightforward. Yeah, it's a very straightforward study that they made, no? Something very easy to evaluate. So kung talagang convincing naman that it can be used for that, we can either approve it or disapprove it within 48 hours.
It has to be the company, not the Red Cross.
It has to be the owner of the certificate. Kasi yung certificate, yung ipapa-expand nila bibigyan nila ng bagong indication yung certificate So yung owner ng certificate, siya yung magpapagawa nun.
Okay. Nawala yata.
Yeah, si Doc. Doc, can you hear us?
Yeah, I'm here.
Yeah.
Okay.
Doc, I'll back up a bit po dun sa Sinopharm vaccine kasi we hadn't heard so much of Sinopharm until pumutok yung story ng PSG. Before that, it was mostly Sinovac, and then comes Sinopharm. Can you tell us a bit of what you know about Sinopharm, its manufacture, and its history, if you have any information on that?
Yeah, well, in fact, of the two Chinese vaccines, yung Sinopharm, yung mukhang mas advanced, no? This is developed by a state-owned corporation. It's a pharmaceutical company owned by the Chinese government, and they started using it in military personnel and then all outgoing overseas Chinese workers. Ini-inject nila niyang Sinopharm. So mas wide actually talaga ang use ng Sinopharm sa China. And in fact, this parang late last week, they already got a wider kind of emergency use approval, what they call a conditional approval for Sinopharm. So ito talaga yung ginagamit na bakuna sa China. Yung Sinovac, medyo under development pa yan, no? Ginagawa Turkey and in merong isa sa South America and Indonesia.
Brazil, di ba?
Brazil. No? Pero yung Sinopharm, ito yung state-owned na vaccine. Sa Brazil, yes, right. Turkey, Brazil, and then in Indonesia, they're going to start a trial. Then they're actually also applying for a clinical trial with us, yung Sinovac. Meron na lang konting requirements na kulang. Pero yung Sinopharm, ito talaga yung mas widely used sa China.
Sir, yung Sinovac is privately owned ba? Sinopharm nga kasi is government Pero what about Sinovac?
Yes. Sinovac is a private firm as far as I know, yes.
Okay. But sir, linawin ko lang, yung kanina kasi nabanggit nyo, Sinovac yung nag-a-apply ngayon. Sinopharm, as you said kanina, wala man lang kahit feelers?
Nung ito yung nung May, they said that they were developing a vaccine and then they wanted to ask, parang nakipag-usap kila Secretary Duque at the time kung pwedeng dito gawin yung clinical trials nila, no? This was in the news. And then they were told by the DOST na sige, send us parang we can talk about it. However, what they wanted was for the Philippine government to shoulder the cost of the clinical trial. So at that time, the OST said na we only fund the WHO clinical trial, not the trial of individual companies. So nung October, nagsabi sila, okay, we're not interested in doing clinical trials in the Philippines anymore. But since then, wala na rin contact and they haven't asked about the emergency use authorization application from FDA until now.
Okay, I asked because there was a report from quoting Philippine ambassador to Beijing, Chito Santa Romana, that he's saying that Sinopharm is expected to apply for an EUA sometime this week. Have you heard of that? Is there any update on that?
Well, I did hear that, pero so yun nga, sa amin, wala naman silang. We had the guidelines for the EUA application published. We sent it naman to all the to all the Philippine embassies for them to be able to share with the countries where they are in case merong interested. And of course, it's available online. So it's possible naman that Sinopharm already took hold of it and are already looking for a representative here in the Philippines that will apply for them.
In the meantime, Yusek, ang magki-clinical trial sa atin is Johnson, di ba, of Johnson & Johnson. Can you tell us more about it? Anong mangyayari doon sa clinical trials na yon?
Yes, I mean, this is one of the later products that have been developed. So na ito yung hindi siya kasing aga nag-start ng mga Pfizer or AstraZeneca. However, they are now on their starting with their clinical trial, phase 3 clinical trials. We gave them that approval last week, and I think they would start probably by this week or next week, and it will involve a few thousand Filipinos, and of course they also have it's a multi-country trial if I'm not mistaken. So they're also doing it in other countries. Ang maganda rito, in a few months we're going to have some early results on their safety and efficacy profile. Talagang makikita natin yung effect niya sa actual Filipino community, no? And once they have enough data naman to support an approval for an emergency use then they can also apply with us, but that will probably take a few months from now pa.
Kapag ganon, priority access tayo kapag ganon, if we are involved in the clinical trials.
Well, generally that happens, no? Kasi usually it happens where they do their clinical trials, they get access there first. First of all, it's easier to register your product and get approval in a country where you did your clinical trial, and usually since nga naging ginawa naman dito, inuuna nila, no? Happens.
In the meantime, Yusek, this matter of lining up and making sure that kahit papano nasa pila na tayo, may order na tayo, yung negotiations for any of these companies does not necessarily have a dependency on the EUAs and the permits that they're asking for. Those proceed on two different tracks, whether or not they get their EUA fast enough or not.
Yes, no, they can proceed, like for example sila US, sila UK, nag-order na yan, 'di ba, ng Pfizer, ng Moderna before they got any EUAs, no? Kaya pagdating ng EUA, nabili na nila, nakuha na nila agad. So that can happen. However, if they are not able to secure an EUA here in the Philippines and we are not going to give them that authorization, they will not be able to complete that purchase and use that product here.
Okay.
Okay.
Doc, before we let you go, I'll squeeze in one last question po. I'm sorry, I'm really curious eh. Dalawang linggo na to eh. I was wondering lang po, when the President guested you dun sa kanyang late night address, tapos sinabi ng Pangulo na halos lahat ng mga sundalo, during that time, sinabi niya, halos lahat ng sundalo, nabakunahan na ng Sinopharm. I was wondering po, what it was like for you? What did you think and what did you feel like when the President told you that in front of everybody?
Well, it was a shock, no? I know for a fact na walang registered at saka authorized na bakuna sa Pilipinas, no? And well, I was really surprised, no? I was looking at the Secretary of Health and trying to get some sense of what was happening. It was very it was a very uncomfortable
Surreal.
situation for me. So might be a word.
Ano reaction ni Secretary
Opo.
Kasi hindi namin makita dun sa TV eh.
Oo, siyempre nagtingin na kami. Siyempre, ang tanong ko sa kanya, do you know about this? Yun ang itsura
Ano
nung...
sabi niya? Ano sabi niya?
Sabi niya, hindi.
Ay, hindi rin niya alam.
Hindi rin niya alam. Gusto ko nga siya tanongin eh, ikaw ba nabakunahan na?
Doc, did you ever get to ask him? Did you ever get to ask him kung nabakunahan na nga siya?
Hindi siya nabakunahan.
Hindi siya yung cabinet member.
Hindi siya nabakunahan.
Okay. Dr. Eric Domingo, Undersecretary Eric Domingo, sir, maraming salamat po for joining us tonight and thank you for your time.
Thank you,
Maraming
sir.
salamat.
Ingat po.
Salamat, Yusek.
Well, and that will be all for this midweek edition of the Chiefs. We hope what is discussed here will keep the conversation going. I'm Ed Lingao News.
I'm Ami Pamintuan of the Philippine Star.
I'm Robbie Alampay, and we are One News.